one act of life to another. The key bills we'll discuss today, which address the state of mental health in Colorado, reflect this need for support across the lifespan. Investing in a strong start for all children is one of the most important things we can be doing as a state with a human purpose. Families need support and stability to thrive. Mental well being should be attainable for more of us as we age toward the end of life. Coloradans should have access to quality, affordable health care and housing. We must reduce the harm caused by drugs and alcohol and by misguided responses to substance use. Jails and prisons should not be our largest mental health facilities, and mental health discrimination must become a thing of the past. Each policy we mentioned today positively impacts the well being of our state and will help Colorado achieve healthier minds from one end of life to the other. We are proud of the steps Colorado has taken toward healthier minds across the lifespan. Thanks to the foresight of Mo Keller, our Director of Advocacy, Colorado will be better positioned than many states for the implementation of the new national 988 number for suicide prevention and crisis intervention. And thanks to the tenacious leadership and patient stakeholding of Lauren Snyder, our state policy director, Colorado is on the verge of creating the state's first protective standards for how we treat people with health conditions in our larger county jails. Though we are proud of our accomplishments as a state this session, we are still looking forward. We can celebrate this high note of victory, but we also recognize that we need a transformed landscape. This is incremental progress that we've been making along the way, but there is still so much work that needs to be done and lives that remain at great risk.
Thank you, Vincent. We are going to hand it over to Mo for the next 10 minutes to discuss two bills. If you want, you can turn on your video. We'd love to kind of feel like we're having a face-to-face conversation with you all. So first, Mo will talk about House Bill 1258, Rapid Mental Health Response for Youth, which allocates funding to provide screenings for 3 mental health sessions to support Colorado's youth in pandemic recovery. And then Mo will also talk about Senate Bill 154, which implements 988 as a crisis response number, kind of similar to how 911 works. Mo, if you wouldn't mind adding a pause between each of these bills as well for questions.
Happy to, and thank you. Good morning to everyone. We appreciate your interest in advocacy and legislative efforts, and we cannot do this without you, so thank you for being part of this effort. So House Bill 1258 is referred to as Rapid Mental Health Response for Youth. We have recognized that there is a significant rise in anxiety and depression in youth, which has been compounded by the COVID-19 lockdown. Since the pandemic began, the Colorado Crisis Services Hotline has experienced a 30% increase in calls and texts. And Children's Hospital Colorado has seen a 10% increase in the number of kids who visit the psychiatric emergency department due to thoughts of suicide. And you may have seen about a week to 10 days ago, Colorado Children's Hospital had a press conference in which they declared children's mental health at a crisis point. House Bill 1258 provides a voluntary temporary screening and referral program for youth before they go back to school this August, September. So there'll be a screening tool, it'll be uniform, and it will be available on a portal housed at the State Office of Behavioral Health for children and youth to voluntarily, so if they wish, take a mental health screening before the fall semester begins. And if this screening indicates the need for referral to a mental health professional, the Office of Behavioral Health will provide 3 free sessions with that professional. The department is required to maintain a list of qualified professionals who wish to be part of this program, and they will establish a provider compensation for those professionals, and they will conduct an awareness program, including community partners, to make everyone aware that families and children aware that this service is available. The department will then also keep data, and they'll present this data to the legislature in January of 2022, and again in June of 22, which is when the program expires. So this is a one-time before school begins screening to help and assist our youth who may be experiencing anxiety and or depression due to the year's events of last year. And so with that, that's the basic outline. I'll take questions if you have any on this one.
I have a quick one, Mo, which is thank you so much for all your work on all these bills and for everybody at Mental Health Colorado. Do they have an ETA for when they think that portal will be up?
Yeah, they're hoping to have it up before August 1st.
Okay,
That's the
that's good.
idea. Um, so the Office of Behavioral Health is working hard right now in terms of making sure they have a good and accurate screening tool to get that on the portal and to advertise it, and then to get all the professionals lined up so that they have enough for referrals. So it'll be in August because school will begin in September. So the idea here is to have kids screened just before September.
That's great. I can think of
Yeah.
lots of different networks to share that with. Thank you, Mo.
Yes, great, super. And we can keep the Brainwave in touch when we hear more from the Office of Behavioral Health on their plans and what they're doing. We can get that information out to you as well. Super.
Any other questions for Mo? All right, Senate Bill 154.
Great. So Senate Bill 154, we refer to it as the 988 bill. It establishes 988 as the call number for the National Suicide Prevention Lifeline. So last October, Congress passed legislation and the president signed a bill that requires all the states in the country to adopt 988 for the Suicide Prevention Lifeline, which is currently up and running based in Virginia, I believe. And it's a product that's been up and running for about 10 years now. Originated with the Veterans Administration and SAMHSA, this Substance Abuse and Mental Health Service Agency, which is a federal department. And they have been running it, but it was 10 digits. And people don't remember 10 digits, particularly if they're in crisis or if they're in an emotional state. So this bill at Congress allows for, requires 988 to be the number that all the states will use. It also requires all of the phone providers, so your service provider for your mobile phone and landline phone or your prepaid phone to initiate a surcharge on your bill in order to pay for this. So first of all, I want to emphasize that 988 as a legitimate working number will not actually be up and operational until a year from now. It'll be July of 2022. And the main reason for that is twofold. The first is that there's a lot of technology behind the scenes that has to take place before the number will be recognized as a complete number. So the state Public Utility Commission is working with the Federal Communications Commission guidelines on how to make sure that all of the technology and the lines talk to each other and the phone and number is recognized and all that kind of stuff beforehand. So that's one reason. And the other is that we need to have a sustainable funding source to keep this going. So we have in our bill a surcharge on all of our phones, as I mentioned. It will be 15 cents a month, 15 cents a month, starting in January of 2022. And that money then will start to accrue and come in. It will be in the Department of Treasury, and the Public Utilities Commission will access those funds to get the money out to the Office of Behavioral Health, which will house this program. So we will have a sustainable funding source at that part. When the bill passed, Mental Health Colorado jumped on this to get Colorado in compliance with the federal law. And I am honored to say we are the third state in the country to pass a 988 bill. We were beaten out by Utah and Virginia, but we're moving along. And so we put together a large stakeholder group in January, and we had all of the phone companies, we had all of the counties, we had all of the state departments that were involved. We had advocates, we had a lot of nonprofit partners. We all came together and we worked out writing this bill, and we crafted the language, and we made some amendments when they were requested, and all. And so we got it all written. And as a result, we had no opposition to the bill. So the bill went through both the Senate and the House in all the committees without opposition. T-Mobile was one company that actually testified in support of the bill in the House. Their regional director for corporate affairs actually testified in favor. So we're very pleased that this has gone so smoothly. Colorado Office of Behavioral Health and Department of Human Services also received a planning grant from the Federal Communications Commission for planning how all of this is going to roll out. And so we do have to make sure that this 988 number for suicide prevention will sync with our current crisis response number that we have here in our state, which is a 10-digit number. And so we want to make sure that those talk to each other and they continue until such time down the road a few years where they will eventually almost certainly merge. That's kind of the long range goal that they will have. They will all share the 988 number, because we do recognize that once 988 becomes the crisis number for suicide prevention in July of 2022, people are going to start calling that number when it's not just a suicide issue. I don't want to say just, but when it's not a suicide issue. So there might be other things going on or whatever, but that's the number they're going to remember. And we recognize that. So there's going to be work in the years ahead to eventually merge those two systems. And so I did want to just end with saying that the crisis line that we have and our mobile response, which goes out now to communities when there is a need for a mobile response to a crisis situation. That has been up and running in Colorado since 2013. And I have found out something I did not know, and that was that we are one of only 3 or 4 states in the nation that actually has that system up and running. So we're very much ahead of the curve, very much ahead of the country when it comes to implementing this, because a lot of the other states have to build from ground zero. They have to build their crisis system, and we already had that done. So with that, I will end on Senate Bill 154, which, by the way, is being signed by the governor today.
Awesome. Any questions for Mo on Senate Bill 154 or anything else she's mentioned? Great. You can always interject if you do think of questions, or leave a question in the chat. So thank you, Mo. Now we're going to hear from Lauren to discuss 3 bills. House Bill 1021 for peer support professionals addresses the mental health workforce shortage. House Bill 1085 for secure transportation in a mental health crisis. And lastly, House Bill 1211 addressing regulation of the use of solitary confinement for people with specific health conditions. And again, Lauren, if you don't mind just pausing between each of those for questions.
Sure, no problem. Good morning, everyone. Hope you're having a great Monday. So the first bill I wanted to talk to you about was, it's our peer support professional bill, House Bill 1021. It was signed into law and was championed by a bipartisan kind of slew of legislators. So Representative Pelton from Northeastern Colorado, Representative Caraveo from Thornton, and then we have Senator Heisey and Senator Zenzinger in the Senate. So basically what we encountered and what we were finding out when we were doing research on how we can support peers in our behavioral system is that peers specialists would only be able to bill Medicaid if they worked in one of 2 locations, either a community mental health center or an approved substance use treatment clinic or facility. And so we were trying to figure out how we could support peer-run, peer-led organizations. And so we, through House Bill 1021, created a recovery support services organization, which is basically a peer-run organization that delivers peer services. And so that RSSO, Recovery Support Services Organization, would have to be approved by the Office of Behavioral Health. Once they have that approval, they can go to their local RAE or any RAE statewide to be enrolled as a provider, and they would be able to bill on behalf of the peers that they employ. And so we're really excited about this bill. We think it's going to greatly expand where peers can work, and really kind of separate this treatment and recovery survival type of situation where peers can really have a peer respite home, or through the RSSO, a peer could work, say, in an OBGYN clinic. A woman with experience with postpartum depression can work with other new moms who are experiencing or may be experiencing postpartum depression or anxiety. Or they might be able to go work in a hospital or a library. Basically, the sky is the limit on where peers now can work through this RSSO model. So really excited about that bill. I guess I'll pause there if there's any specific questions about the peer run RSSO bill. Okay. Next bill is House Bill 1085, which is about secure transportation. Again, when you're listening to our brainwave and consumers and family members, we are hearing repeatedly somebody may be on an M1 hold or was being transferred to a detox facility or something, and they were transported in one of two ways. One, in a costly or traumatic ambulance, or that they were transported handcuffed in the back of a police vehicle. I think both of those transportation models just didn't really work for individuals. Many times maybe an ENT didn't have any type of behavioral health training, which led to additional charges against the individual if there was an assault or anything like that. And so we were looking across the nation about what can we do, and there's various other states that have implemented this type of transportation model, which is referred to as secure transportation. So basically, it's kind of in between an ambulance and a I would say an Uber or something. So it could be an SUV, a car, or something like that, that is staffed by trained individuals in de-escalation and CIT, that is there basically to transfer somebody who might be on an M1 or is in crisis or is in a substance use crisis to a facility, a walk-in center, a detox, a hospital, etc., in a more person-centered way. And so not only did we create this type of licensing type for secure transportation model, we also paired it with Medicaid reimbursement so that we have sustainable funding for these types of transportation services. The bill does allow co-responder models to be licensed as secure transportation providers if they get the proper licensure and training and all the regulatory things that go along with that, so that they would actually also be able to bill Medicaid, which we hope will bring more sustainability also to our co-responder models that are typically grant funded throughout the state. So we're really excited about that. How the bill is written actually allows Medicaid to expand this model and this benefit beyond just secure transportation, but to fund crisis intervention in the community in general. So we were very specific and very thoughtful about how we wrote that to give HCPF utmost flexibility to fund crisis intervention in the community. Any questions about that bill? It was signed yesterday in Summit County, so we're pretty excited about that. Okay, cool. So our last bill I wanted to talk about was a Mental Health Colorado agenda bill as well, House Bill 1211. It was championed actually by one of our former board members, Representative Amable from Boulder, and then Senator Lee, who's from El Paso County. when we started to do a lot of work and heard from our brainwave community about the number of people with mental health conditions who are entering the criminal justice system, and when they were in jail, many times awaiting a competency restoration evaluation or restoration, they weren't placed in general population, but that more often than not, they were experiencing solitary confinement in our county jails. And so I knew that we had, some regulations and state laws around the use of solitary confinement in our youth services, our youth corrections system, as well as our Department of Corrections system. But come to find out, we have no regulations. There's no oversight on what really happens in our county jails, specifically what happens around solitary confinement in our county jails. And so that's what this bill was all about, was trying to protect our most vulnerable individuals who are in our county jails, who are experiencing isolation and solitary confinement. So the bill basically prohibits somebody with a mental health condition, an intellectual or developmental disability, a traumatic brain injury, a pregnant or postpartum person, an individual who may be blind or deaf. I think that's, am I missing anyone? I think that those were the populations. So really people who are, and juveniles who may be in the jail system. It prohibits them from being able to be placed in solitary confinement in our county jails. It does include exceptions to that, but those exceptions would require the jail to take the person to a hospital before placing them in solitary confinement. It requires them to get a court order after 14 days, which is a international standard. And then if they are placed in solitary confinement, it lists a plethora of rights that person has. Right to a shower, right to see their legal representation. They need to be checked on every 30 minutes. They need to see a mental health clinician every 24 hours. So those types of things, really to change those conditions of confinement where we heard were pretty egregious and disproportionately impacted people with mental health conditions. So not just does Mental Health Colorado advocate for where we want people to go, but also making sure that where they're at now, we are making sure that they're being treated with dignity, respect, and in a humane way. So that bill was signed into law last week and will go into effect. We'll start collecting data from county jails starting in January, and it'll go into effect next July. Any questions about the solitary confinement bill, House Bill 1211? No questions. All right, you guys got off easy.
You're explaining it so well. So next we have Mo covering House Bill 1097 to create a behavioral health administration.
Okay, this one is very interesting because for a very, very long time, everyone has recognized that the way we deliver or try to deliver and or try to fund services and treatments for individuals who need them, wherever they might be on that spectrum, has been just a total disarray. They don't talk to each other. There's no continuum of care. People argue over the same amount of money for funding and all this kind of thing. So in 2019, Governor Polis created the Behavioral Health Task Force to seek community statewide input from the input on mental health services and what the barriers are to care. And they traveled all over the state. They got a lot of good feedback. The mission of this Behavioral Health Task Force was to evaluate what they were hearing and create a plan to improve the current behavioral health system in Colorado. So after many stakeholder meetings with over 100 recommendations for improvement, the number one recommendation that kept popping up and it was chosen was to establish one overarching administrative agency that would oversee all the state programs. So the agency would be here and the state programs, including their funding and how they work together and continuum of care and how they talk to each other, was going to be housed in that, the responsibility for all that to work was going to be housed in that administrative agency. So they wanted to coordinate care. They wanted to improve delivery of mental health services. They wanted to ensure care access. So no matter what agency a person showed up in, they would get access and then that continuum and a handoff. They wanted to establish a continuum of care across all the systems. So in other words, to act as the single state agency responsible for the delivery of mental health services in Colorado. So the House bill 1097 requires the Department of Human Services to develop a plan for that creation, that behavioral health administration. So it gives them the statutory authority. Yes, the legislature said, we need this, we need a behavioral health administration. And then, okay, now you at Office of Human Services, with working with other state agencies, you go for it and you create that plan. They have to have all those specificities and all those specified duties by July 1st of 2022. So they have a full year for that part to enable this to move forward with a comprehensive plan. So the Behavioral Health Administration must identify barriers to care, and they have to find solutions to those barriers. And for the first time that I can recall, they must include all the social determinants of health as part of mental health care. So they have to eliminate fragmentation of care. They have to integrate mental health care with physical care. And they have to provide transparency throughout the entire system. So this is a huge undertaking. So they'll create the plan. Now, then again, they will have stakeholder input. And they must submit this plan to the Joint Budget Committee by November. So they're getting everything ready. They're coming up with these plans. They're going to have a lot of more stakeholder hearings. And then their outline of this plan will be going to the Joint Budget Committee in November. And then I think it's November 1st. So the creation of this, as recommended by the task force, has to include recommendations for funding, legislation to implement the plan if they need it. They may have to change some laws in order to do this, or change rules if they have to do that. They have to have a good, strong list of state programs that should be managed by the BHA, the Behavioral Health Administration. The governance structure, who's going to be on the governance structure, all of that. Potential opportunities for collaboration with local governments. How will they administer and create a better system working with local governments? They have to have recommendations on how to deal with grievances and appeals, and how they incorporate the ombudsman service that we already have running up in terms of this whole behavioral health administration. So they have to have a data integration plan. How are they going to get all the data from all these different agencies and together so that they can be compared and or consolidated? And then they have to have a description of how to ensure the availability of programs and to establish a standard of care. So huge undertaking, a pretty serious rewrite or creation of a new way in which to try to do a more effective approach towards serving the citizens of the state. They will be developing recommendations that align and integrate the Behavioral Health Administration with medical assistance programs, including private insurance, and prevention and preventative services. So a really big undertaking, and they will be having numbers of meetings and stakeholder groups throughout the line. And as we hear about those, we can keep you apprised as to how you as a brainwaver might be able to participate or at least follow along in terms of the conversation and be able to contribute to this building of this new agency. And so with that, I'll let it go and see what you might want to ask. Okay. The next House bill is 1068, and that is mental wellness annual exams. This is a second-year effort by Representative Michelson Janae, who lost this bill last year because there was concern, particularly out of the governor's office, that it might increase premiums. So what this bill does is it requires all of the private insurance companies to offer free to the client, to the enrollee, a mental wellness checkup, a mental wellness exam once a year, just as private insurance companies have physical wellness checks. This would require a mental wellness check. And as I say, it would be at no cost to the consumer. So to address the concerns of the governor with regard to the potential premium increase, this year Representative Michelson-Jeannet put two amendments on the bill. And so this bill did pass, went through the legislature, and the governor has agreed to sign it. The first is an actuarial study that must be provided. And so that actuarial study will look at the costs of this potential increase in premiums, if there are any, in terms of the private insurance companies, by them offering this mental wellness exam. And I would like to add that as it's once a year, the exam itself can be given by a wide list of mental health professionals. So could be a psychiatrist, could be a psychologist, could be a licensed clinical social worker, a family and marriage therapist, licensed clinical or licensed professional counselor. All of those can be the ones to offer that. So it'll be spread out. The second amendment is that the Division of Insurance must submit a request to the federal government, being the Colorado Medical Society, the Colorado Medicaid Medicare Services is the name of it, CMS, regarding a technicality. And this technicality is this, that the Affordable Care Act, when it passed, had essential benefits, and behavioral health was an essential benefit. And under that essential benefit were the lists of what that meant. So it meant depression screenings, it meant alcohol screenings, it meant other things, and was all listed. We have adopted those and placed them in our state law. However, the Affordable Care Act also said that if any state decides to add to the essential benefits something that isn't there, the state had to pick up that cost. So our question to the federal government with regard to the Affordable Care Act is, since that provision is there, is an annual mental wellness checkup going to be considered on and above what the essential benefits are that are guaranteed under the Affordable Care Act? And if so, does the state have to pick up that cost? And so we have to then, so they are required by this amendment to find that out. And we will have to wait and see what they say. There is a limit, a time limit in the bill that says if we don't hear back from the federal government within a period of time, and I have forgotten what the period is, it was 90 days or maybe 6 months, that it automatically goes into effect and is assumed to be okay. It applies to large group policies or contracts by January of 2022. So this January to the large group, and to the individual and small group practices, it will start in January of 2023. Now, we're very supportive of this effort. This was not our bill. This was Representative Michelson-Jeannet's bill, but we were definitely out in front, certainly supporting it, testified in favor, attended the press conferences and support, et cetera, because we recognize that prevention and early intervention of mental health issues can lead to better outcomes for families and all people throughout their lives, and that mental health conditions occur in youth before the age of 6. If they do, can interfere with emotional, cognitive, and physical development. And we also recognize that aging adults have mental health conditions sometimes that can adversely affect their health as well. So we felt strongly that this mental wellness checkup was important to have as part of our efforts to continue wellness through the lifespan. So with that, I will stop there and see if you have any questions.
All right, if we have no questions for Mo, we're going to move on to our last bill, which Lauren will discuss, which is Senate Bill 137, Behavioral Health Recovery Act. And then we will move to any final questions you may have and some final thoughts from Mo, Lauren, and Vincent, and then we will wrap up for the day.
All right, so the last bill, Senate Bill 137, actually was, introduced by Senator Pedersen in the Senate, and then also had Senator Wilson or Senator Winter, and then Representative Michelson, Janae Michelson, and Kennedy in the House. Sorry, excuse me. It was really an omnibus bill. I believe the final fiscal note was over $114 million. So it's a really big bill, very exciting to have that much money and put it towards the system. And it did a lot of things. I'll just highlight a few. So one thing that it does is expands the number of screenings that can happen under a child's Medicaid plan for their caregiver, right? So if I'm a mom and I take my kid to go to get a well visit, I get additional screenings for me, for my mental health, right? A depression screening, etc. So now it'll be 4 screenings instead of 3. So it funds that. There's $4 million going towards temporary financial housing assistance. There's $1.6 million towards a recovery grant program that's going to go directly to recovery organizations to provide those services. There is $9 million actually going directly to our counties, so that they can fund mental health and substance use services in ways that they think represents the needs of their constituents. So $9 million going towards that. There's an $18 million going towards workforce development. So the Office of Behavioral Health is going to create an online training system along with curriculum for mental health and substance use providers. There's fiscal incentives for lower income individuals. There's capacity building grants to diversify our safety net provider workforce. We've heard that a lot from consumers. I want somebody who speaks my language, who looks like me, who understands what I'm going through. And so there's going to be a real big push to have some type of capacity building and grants to diversify the workforce. There's also a big focus on kids. So there was, trying to find $5 million towards crisis services for youth. So that could be mobile crisis response that's specific for youth. That could be funding that could be used for a crisis stabilization unit specific for youth. So lots of services there. There's also funding going towards residential childcare placement options. I've heard a lot of youth are getting stuck in hospitals, and there's not really anywhere in the community for them to step down to. For individuals and youth who have more complex needs, behavioral needs. And so there's funding going towards developing those types of alternative options. We were also able to get actually $26 million for care coordination. As Mo alluded to, the governor's behavioral health task force had a number of recommendations. The first was the Behavioral Health Administration. And I would say second behind that was a recommendation of a statewide care coordination option, where it's a kind of a one-stop shop everyone can go to. Mental Health Colorado worked on some language around the eligibility for that. So $26 million going towards that. Mental Health Colorado also championed a bill a few years ago to create the Behavioral Health Ombudsman office. That's currently staffed by one person, and the need is overwhelming. And so we got additional funding to allow that ombudsperson to hire more staff with a hope that they actually are going to be hiring people with lived experience, so peers themselves. There's $1.7 million going towards health services core, right? So you can get some loan repayment options if you work in specific areas of high need. And we were also able to get $5 million for our county jails to help them comply with the solitary confinement bill, right? So if they need to do structural changes, staffing changes, etc. One of the biggest things that happened in Senate Bill 137 was the creation of an interim behavioral health task force, I guess you could call it, another task force. But this one was actually going to be specific to our ARPA dollars, so the federal relief dollars that are coming down from the feds. They earmarked $550 million for behavioral health. And so this task force that's going to be meeting over the summer is going to be spending and making recommendations for how that money is spent. So $500 million, which is transformational. It's really exciting. So we would implore, if our Brainwave members have any recommendations for where they want funding to go, what would be a transformational change, think big, let us know. It's really exciting. We already have a proposal in front of legislators in the governor's office that would roughly put $165 million towards beds. So inpatient civil beds, but also over 200 residential beds, right? That's what we've heard loud and clear, is the middle is missing. There's no residential long-term, short-term housing for individuals that comes with treatment. How do I step down from the mental health institute? Where can I get these types of supportive services? And so really building out those types of placement options is one recommendation we already have out there, but definitely happy to hear more from our Brainwave about where that money should be spent. So that's Senate Bill 137 in a nutshell. Happy to answer any questions about that one.
All right. If we have no questions, we can move on to our final thoughts, and we'll start with Mo, then Lauren, then Vincent. Take it away, Mo.
Okay. Well, I would say that it's an exciting moment for us in mental health and substance use world and treatments, because mental health and behavioral health has the support overall, and there may be some specific differences, but generally it has the support of both political parties. Right now, we have seen a lot of cooperation with Democrats and Republicans alike in moving forward with various mental health funding and treatments. And so this is an exciting time to be able to capitalize on that willingness, the political will. Also, the federal dollars that are coming down to the state are unprecedented. And we have so much earmarked for mental health, as Lauren was speaking about, that we should think big and we should go for it. And, while these are one-time funds, that's true, and we have to come up with sustainable funding, the infrastructure that can be built, or the infusion of getting a baseline set up for mental health and substance use treatments is right now. And so it's an exciting time. It's an exciting time to be a brainwaver, because you have open access to both us and or other legislators, but channel your ideas to us, to Lauren and myself, and we will definitely get them included in the interim committee that will be held this summer, probably starting in August is what we're thinking at this point. So, we have a receptive legislature. That legislature has allocated all this money. They are there, willing and ready and waiting and wanting ideas from us, because they don't have all the answers. They want us to come in and give them that. So let's go for it and let's give them that. So thank you for being involved, and let's do it.
Thanks, Mo. Lauren?
I don't have much to add. I think Mo is spot on. It's an exciting time. There's still so much work to do. The need is overwhelming. When you look at hospitalizations and suicide rates and overdose rates, it's hard to see. It's hard to really wrap your mind around how big the need is. But there's a lot of opportunity too. We have a lot of dollars. We have the political will at the Capitol, I think, is starting to really understand mental health, and that we all have brains that we need to take care of. So it's just an exciting time, a lot of opportunity, a lot of need. And we're excited to take it on.
Thanks, Lauren. And we will go to Vincent, and then we have one question that came in.
Thank you. Yeah, thank you so much, Lauren and Mo, for all your work this season. And thank you all for joining us this morning. You know, with this opportunity, I just want to reiterate in pretty much everything I say that housing is first. Housing first is a principle. And right now, we house a lot of people with acute mental health needs under bridges and in parks. We move them around, we move them to jail. Jail and prison is where we house people. So when we have a unique infusion of cash, I think one of the best things we could be doing as a state is understanding what supportive housing is and making much more of that available so that we can really be first in the nation to get smart about what people need to be healthy.
Thank you, Vincent. And I'm not sure who this question is directed to, so whoever wants to just jump in. Will any of this federal funding go to improving the care at our state mental health hospitals? Thanks, Vincent. Bye.
I thought he was raising his hand to answer, and I was going to say, oh. Yes, to answer your question, yes. Funding will go to Pueblo and to Fort Logan in terms of increasing bed space, but we're also looking at housing. So one thing we're looking at with regard to Fort Logan is they have a number of empty buildings there. Can those buildings be upgraded by code effectively, financially effectively, or can we build or should we build a new building on that campus that would be cheaper than trying to upgrade the old buildings because they're from the turn of the century, the turn of the 20th century. So that is on the list for sure. We are looking at that. We also have to be careful in terms of housing on either of those campuses. Can we then get Medicaid drawdown because of the IMD exclusion, if you might know about that, Institute for Mental Disease exclusion at the federal level does not allow payment, Medicaid payment to individuals if the facility is 16 beds or more. So anything we do has to be 15 beds or less. So otherwise the state has to pick up the entire cost, which we are not able to do. So we have an inventory, or we're working on this inventory of state-owned buildings all across the state that are abandoned or not used or have been downsized or any of those kinds of things. Could we set up housing for homeless individuals or individuals transferring out of Fort Logan or Pueblo back into community? That would be these buildings that the state already owns, so we don't have to worry about purchase and all that. But are they upgradable? And then could we find workforce in whatever areas those might be in order to provide housing? So we're looking at that as well. But to answer your question, yes. And then we've expanded as well. And if you are interested, I can send that housing proposal that Lauren has written, which is beautifully done, and send it out to you so you can see several areas that we're looking at, and then maybe give us your response. We'd like that.
This is Amy. Thank you. I used to work there as a chaplain. So, I mean, I see the buildings just sitting there.
Right,
So
exactly.
that's so wonderful that you guys are thinking how to
Yes.
use that effectively.
And I do know when I was on the Joint Budget Committee in 2010, I think I took a tour, it might even been a little earlier. And we were told then that these buildings from the 1890s, they have to have ramps, they have to have electrical upgrades, they have plumbing upgrades, and they just have natural problems being that old themselves. But to upgrade it to current code was fairly cost prohibitive, and there was feeling that it would be better to just build a whole new building. It would be cheaper, as a matter of fact. So some of those buildings are being used for admin purposes, so they're trying to at least keep them going. Yeah, and then we would have to find out if it's on that campus, would it still be considered an institute by definition under the IMD, or whether it would not, in which case that is feasible. Yeah, we can use those. So we're working on it. And Amy, I'm happy to send you our housing proposal. that we're going to be looking at. I'll send you that in a few minutes, and then you can give us your take on it, what you think.
Thank you very much. I
Yeah,
appreciate it. That's
appreciate
great.
your feedback. Sure.
Well, thank you, everybody. Keep an eye out in the next few weeks for our legislative report and scorecard. It'll recap some of the things we discussed today, and you'll also get to see how legislators scored and how they voted on mental health. If you want to learn more and get involved, mentalhealthcolorado.org. So thanks again, everyone, and we'll see you soon. Bye.
Thank you, everybody.